and then I'm going to go ahead and introduce our presenter. Did y'all know that Ageism Awareness Day is October 9th, just a couple of weeks from now? And what opportune timing for us to dive into today's topic of the effects of ageism in healthcare today with our presenter, Gina Rossi. Gina is a licensed clinical social worker in Louisiana for over 30 years. She has focused her practice in helping individuals and families in dealing with life transition issues. Gina is an adjunct instructor for the LSU School of Social Work. Her dedication to training interns in the gerontology program led her to the 2017 induction into the LSU Hall of Distinction as a LSU Alumni of Distinction for the School of Social Work. In 2018, Gina was the recipient of the 2018 Public Servant of the Year Award by the Governor's Office for her work with the Louisiana Office of Aging. She was also awarded the Social Worker of the Year for the state of Louisiana by the National Association of Social Work. So we are extremely fortunate to have Gina Rossi here with us today to present on this topic. If anybody has any questions, go ahead and put them in the chat box. We'll help with any tech issues. Other than that, I'll pass it on to you, Gina.
Thank you. Good to see everybody. Boy, I know that there was a big group that signed up, so I'm excited because I think that to me is an indication that you all are interested in ageism and ageism awareness. What we're looking at October 9th, Brooke was saying, I thought it was October 7th. I said, well, it was Brooke 1 year because that was the year it fell on my birthday. And I told the whole world that my birthday is on Ageism Awareness Day, and it couldn't have been more perfect. So I might change my birthday to October 9th just so it can match. Anyway, I'm very happy to be here to talk to you about this topic. And thank you, Alzheimer's Services, for inviting me. I've done this talk to many other venues, and it is something that I enjoy doing. I will tell you that one of the problems I have with the talk is I have trouble keeping it down to the time length because I am constantly reading, researching so much that I don't, there's nothing that I want to leave out. So a lot of this I'll go through really quickly, take notes. And at the end of this, I'll have my email and you can certainly reach me. I'm always happy to hear about your interest or what your ideas are. And I'll answer any questions too. So a lot of information. We'll go through this quickly. I'm not able to manage the chat that well, but when we have time, I'll ask Brooke. But please feel free to converse in the chat. And when I can, we'll get with you. But yeah, Ageism Awareness, October 9th, and we are going to be celebrating it around the world. And there will be a lot of talks leading up to it. Ageism, I'll go ahead and define it by Robert Butler. And Robert Butler was a person that first defined this in our country. It's been going on for a long time, but he gave us the real definition. He was very involved in psychiatry in Washington, D.C. area, and somebody asked him to review a situation that was going on in Chevy Chase. And Chevy Chase, those of you that are familiar with that area, I used to live around, not Chevy Chase, but that Washington, D.C. area. It's kind of a frou-frou section of D.C., very nice. And there was going to be a public housing development. And they were going to be adding in a lot of older adults into the public housing. And the whole community of Chevy Chase, not the whole community, but the community was very outraged. They didn't want to see this. They didn't want this there. And so when asked about it, he was asked about it and he said, it might be racism, but more so than that, it's ageism. And it's a systematic stereotyping of and discrimination against people because they're old. Just as racism and sexism accomplishes with skin color and gender, that's what ageism does. It's related strictly because your age. And, ageism goes both ways. It can be, people can say, well, that's like reverse ageism when we have a stereotype or we discriminate against people who are younger. And we might make a comment about millennials or well, that's the Z generation, how they are. And when we talk that way, that is also ageist. And we should remember that because just as we don't want the discrimination of people who are older, we should also not do the same thing with younger people. So that's ageism. And once in a while, you'll see these words come up because these words, I do use a lot of these slides and some presentations for social workers, distinctly about ethics or a clinical. And so these are, you'll see, these are our ethical values: social justice, dignity and worth of the person. And so those will come up and you'll see them once in a while. This is, the World Health Organization had a very large campaign about ageism. And I will tell you that in terms of toolkits or what we're doing now, they have a fantastic toolkit. I don't use it because I like to be able to use my own stuff, but once in a while I will throw in a slide here. And their campaign, they defined ageism. And here you see it. It's the stereotypes, which is how we think. It's how we feel, which is prejudice, and how we act, which is discrimination. And ageism is toward others or ourselves based on age, because there is such a thing as internalized ageism. And we'll talk about that. Certainly, ageism is everywhere. And the World Health Organization and other organizations, when they did studies, they will talk about it in terms of self-directed, which is what we talk about, internalized ageism. It can be interpersonal, in between people as we're talking to people, and it can be institutional. Social workers and many of you in the community, we hear the term social determinant of health a lot. And we use it for other things, but we rarely acknowledge that ageism is also a social determinant of health. Social determinant of health is something that's not medical factor, but it does influence health outcomes. So we need to start thinking about ageism as a social determinant of health, and it affects the health care that older persons get. Unfortunately, ageism is something that's not recognized. We see it so frequently, and I'll show you some examples here. We've constantly been bombarded with it, so it's just not recognized. And so what are some examples of ageism? Well, it's a passing remark, just making a comment to somebody. Oh, well, that's how people are. Oh, because, when they're older, they get like that. Last night, I was at an open house last night, and somebody who knows me very well, they're younger than me, said, they were at a trip and somebody was talking about being on a trip and people that were complaining. And she says to me, well, I didn't know. I just thought because, they're old. And I didn't want to be that person at the party, but I said, do you think it's because they were older? Because do you think that maybe that person had that personality all their life? Because certainly we know people who are younger that would complain as well. So it's, that was a passing remark. Sometimes it's a direct insult. Something like, well, you older people are not going to recognize how to handle this technology. It could be being ignored. You go into a party or a coffee shop and you're an older person and maybe you're ignored and the group that's chatting does not include you. It could be being patronized, being called sweetie, how can I help you with that, sweetie? Or, you're at a restaurant with some other people your age. They say, well, what can I do for you youngins? Because they think that's a compliment when they say something like that. And it's not. It's really does not give us dignity. It's, for some people, it's a direct insult. Of course, certainly being denied employment or being denied a promotion. So Tracy Gendron, she is the author of the book Unmasking Ageism, and she gives us a really simple flow chart here. And I find this very helpful for people. And the way you do is you look at, is age a factor and what I'm about to say? If it's yes, am I making an assumption of judgment based on age? If it's yes, you ask a question. If it's no, it's not. It's not ageist. That's good. But if it's yes, if you're making an assumption or making a statement about somebody because of their age, it's probably ageism. Here's an example of something that people in New York were seeing every day in a subway. And take a look. It says, which is, if you're 50, you're dead. And so thousands of people were passing by seeing this every day. This is the kind of way that we're getting constant messages about being older, and they think, oh, 50 is dead. Just constant messages, everyday ageism. I'll talk about a study that was done about that. For example, in Facebook, we see constant memes or making jokes. And when they're asked about it, I have reached out and I've made a point to, when I see something that's ageist, and they'll say, well, select a problem, and they'll list all the problems, but they won't say that it's anything about age. But yet they don't call out ageist hate speech. They'll call out sexual orientation, disability or disease. And I encourage them, and I'm constantly, talking to them, sending messages about also adding ageist hate speech. Same here, slurs about certain genders. but they won't say, that they'll call it out about older people. This is something on LinkedIn. They'll talk about the discrimination, about racism, homophobia, sexism. How about, why not ageism? So, and the way we see the word older or aging, when we see it linked with something, it's always something, frequently, not always, but frequently, it's something ugly, unattractive, hateful. And here's somebody whose boyfriend was killed, and she says, don't let hate make you old and stale and faded. There's a combination there. She puts old in with stale and faded, and she links that to hatred. Here's an example of a card. People thought it was funny. I think we are seeing less and less of this, but people think it's funny to make fun of somebody who might have an impairment, and maybe it's something related to being older. In this case, it's about somebody who has a hearing aid, and they make a joke about it, and they said, again, I said happy birthday. This is a card I got, so I blanked out the name. I will tell you, I'm happy to tell you that since then, I don't get cards like this from my friends. And then there's always people in the office when somebody is getting ready to have an older birthday or they're retiring, and they link that to something. And I did it too. I was guilty of that as well until I knew better. So here is, I want to talk to you. This was a very important study that was done about aging, about everyday ageism. And the reason it's so important, because it was a very large study. And it was a large study from University of Michigan. Yes, Michigan, over 1,000 people, over 2,000 people at the University of Michigan, and on their national polls, and they sampled people from 50 to 80. And what they found were that the majority of respondents were regularly experiencing one form of ageism, everyday ageism. I mean, something they heard, they saw, or some jokes about it. So this is the constant barrage that I'm talking about that we get. It's a constant barrage of making jokes about somebody that's aging, and it's interpersonal, people, in between people, and it causes people to internalize it. This is what we call 36% of the people have internalized it, meaning that we start to believe this. And these are some of the questions that they asked. For example, the internalized ageism. And people start to internalize that having health problems is part of getting older. Feeling lonely is part of getting older. Feeling depressed, sad, or worried is part of getting older. When we start believing that, we stop asking for help. We stop reaching out to a healthcare practitioner, and we start to just accept this as something in our aging. And this is a real problem, because then people don't ask it. And I know this is cute, but guess what? This is how it starts. Young people, we know now that younger people, they can be impressed as young as age 3 or 4. And, a lot of schools now, I think that there's changes. I will tell you that I know that there's some changes, because some people that I've supervised who work in schools, they themselves, when they've gone back to their schools, they've made these changes. Shout out to Parkview. But anyway, this is a 100-day-old day. And so what they do is they try to make a comical view of how somebody who's 100 will look. And this is how they want a little girl to perceive. But the worst part is, look what she has on her back. And so the automatic assumption is that somebody is older, that they're automatically going to need to be redirected, that they're disoriented. And what that creates is a younger person starting to believe this and growing up thinking that this is the way aging is and that this is normal. And it's not. Because one of the things about this is that it also incorporates other media images. An older person is the witch you see down there, or she's a little old grandma type. And not all grandmas are that type. This is really discriminatory and stereotyping somebody. So, and this is how it ends, you all. This is what happens, is that it becomes so accepted that things like this that are supposed to be funny, and this says, hey, old people, less driving, more dying, thanks. During COVID, we really saw it. Terms like boomer remover, a quarter of the people were downplaying COVID. this was on TikTok. So this particular TikTok got 780,000 views. 14% of these contained offensive content. This is what we call explicit ageism. There's implicit and explicit. And then there's ageism by healthcare workers, and it can come as a direct statement. You know, a healthcare worker people who go into healthcare to help people. We know that, but we also know that they are influenced by their values, their history, how they grew up, and how they see the world. And if they see the world and that older people are put into this certain category, that's how they're going to practice healthcare. And none of us are immune. I am not immune to this. Healthcare workers who want to do it, they're not immune to this. They can't help it. But certainly there are explicit statements that they make. We know that there have been, in school, there have been comments made about a particular surgeon that made a joke about somebody who's going into geriatrics. The intern said, I'm going to geriatrics. And that particular surgeon said geriatrics and started making fun of an older person and acting a certain way. And this turns into actions. And implicit, these are the subconscious. People, are not aware of this. This is their implicit thoughts that they are thinking this way when they see an older person come into their practice or in the lobby. They automatically start assuming things. Those of us in healthcare, when we are working with people, we tend to see people who are sick because they come to us because they're sick or they have problems. And then we assume, because our mind works that way, our mind has got so many things going on, 11 million pieces of information going on, that it's just easier for us to automatically categorize things. And when we do, we categorize somebody who's older as just being sick or being a certain way. But the whole world is not sick. And I mean, the whole world of older people. It is a very, this is how the saying comes up. You've seen one 80-year-old? You've seen one 80-year-old, okay? So implicit, and is when it's done without conscious awareness. And if you have implicit, you will have implicit communication. Your tone is going to be a certain way. Your body language is going to be a certain way. The way you listen and the way you have a posture. And this is how your communication, whether you like or not, is going to come out to somebody. Why is this important? Why is ageism so important to me? Because I think it's connected to a risk factor for dementia. These are the risk factors that we know about. And in these is depression and social isolation. If we are in ageist activity, putting people in a certain category, they can more likely become depressed, and they might be more socially isolated because of our actions. This is why this is a connection that I want this to make to dementia, but I'll make another connection here shortly. So in healthcare discrimination, in a study done by the General Internal Medicine, 1/3 of older adults say they frequently experience age discrimination. 1/3 of the respondents, I'm missing a third here, but you should know that 2/3 of this problem. 1/3 of respondents reported frequent healthcare discrimination they developed a new or worsened disability over 4 years. When you compare that to people who experienced it infrequently, they had less disabilities, 16.8%. And people that who felt like they'd never experienced ageism, they had 14%. So the less they experienced it, the better their healthcare was. Certainly for healthcare professionals, there are many treatment dangers with ageism. They can be undertreated. They could be denied treatment because of their age. They could be overtreated. And what I mean by this is that maybe there hasn't been enough studies about their illness, because the illness is not a priority, because it's not a priority because we don't see the illnesses of older people as important. We're focusing on other things. When we look at the number of pediatricians to geriatricians, for example, we see a lot of attention, a lot of exposure on people who are younger, and much less on people who are older. So these are some of the dangers. Here's an example. To me, this is a big example of ageist. You probably saw this came out a while ago, and that is that the U.S. Preventative Services Task Force recommended adults under the age of 65 be screened for anxiety. Well, oh my goodness, aren't we glad that at the age of 65 that we don't have to worry about anxiety anymore? That's great. This is what we've been hoping for. Unfortunately, we know that there are many more people who have anxiety at older age. We know that people who are 65 older have also had traumas. I've read a statistic in here that said that 90% of people who are over 65 had experienced a trauma. But yet, when we talk about PTSD, that is an age group that is not included. The National Council on Aging says up to 25% of adults 65 and older are living with a mental health condition, such as anxiety or depression. And this is in 2023 from the National Council on Aging. Kaiser Family Foundation in 2020 says overall, 1 in 4, 24% of adults 65 and older report anxiety or depression. Anxiety disorders in older adults are fairly common, affecting 10 to 20% of the people. Yet, the U.S. Preventive Services did not feel there was a need to include. There is something about our healthcare system, our education system, that has a focus on the lifespan, and somehow it drops off around 65. Social justice, for those who are social workers, directly related to our values. This is a study from Australia. Older adults, I'm sorry, not Australia, England. And right, it's not related to our healthcare system, but it's an indication of healthcare systems around the world and how they work with older adults. And in this study, found that 1.4 million people were referred for help. 1 in 10 were over the age of 75 were estimated to have depression. And here you see the numbers, 87% were treated with medication. But throughout the study, they found that the general practitioners would dismiss talk therapy as an option for their treatment. See down here where it says 85% were 5 times less likely than somebody who is 59 year olds to receive psychological help. In some areas of England, only 3.5% of the people who are 65 and older were recommended by a therapist to undergo cognitive behavioral therapy. And even though research tells us that people who are 65 and older continue to benefit from CBT, cognitive behavioral therapy. Over 65 were twice as likely as younger persons to be treated with antidepressants. Antidepressants are important, but what we know is that must go with talk therapy. Previous study that we talked about just a minute ago, 90% of older adults have experienced a traumatic event that can have lasting effects on their well-being. We know this too about clinical trials. Clinical trials, even when they are meant for an illness that might be related to, that is more found common in an older person, even in those situations, the pool of candidates in that clinical trial, the average age might be like 58. Even the people that experience this the most might be age 75. There's been some difference for that. And good news for this is that now in a lot of those federal grants, the agency, the research organization has to describe how they are including older adults, or there has to be a statement made for about why they're not including them. And that's good for clinical trials that are, reimbursed by, that are funded by federal agencies, but private clinical trials are, they don't have to follow that. So there has been some improvement on that, good, but not as enough. And I know you all see this. This is what we call elder speak, and this is one of the healthcare actions that when I talk about explicit and implicit, we sometimes look at an older adult, and I know this because it happens to my parents. They say, "Oh, your parents are so cute," and I think to myself, "Well, I want to tell you, my father was a retired sergeant major. My father went to Vietnam, and he's more than cute. Okay, he has a full history. My mother as well, and they don't want to be seen like a little puppy dog. When you start talking, when you start perceiving them like that, you will start talking to them like a little puppy dog. You start speaking slowly, and you have an exaggerated way of talking, then your pitch is different, and then you repeat yourself. Would you like some more, Mrs. Smith? Would you like some more? You're giving the message to Miss Smith eventually that she is less capable, and she is not that, you're giving her the message that she is not that really, that accomplished person with a tremendous history and quite capable. So this kind of baby talk is not conducive to developing a relationship. There have been many studies, and University of Kansas is very involved in the study. Here it is. Now they do a free training, and it's online for people who work in long-term care facilities. I called this lady when I heard about it because I wanted to participate, and it's only for people who are working in long-term care facilities. But I asked her, I said, do you have anybody involved? I thought this is so great. Online, free. Somebody who works in nursing can do it free, and they get a certification. And I thought this is so great. Do you have anybody who is doing this from Louisiana? How many people? Zero. Zero people. This is a well-known research, and it's a great training. It's free, and they give you a certification. I don't know what more we need to do to have this education for people. This education, it talks about when people are working with older adults, that the more they talk to them with that kind of elder speak, the more resistant the person gets. Think about it. If somebody talks to you like this, when somebody talks to me like this, I become alert, hyper alert. Why? Why are they talking to me like this? Do they think I'm an idiot? And when they did this study also about nuns who were taking care of other nuns, they were taking care of nuns who had Alzheimer's, they found that the nuns did not communicate that way. They found that the nuns treated their sisters with so much more respect. They talked to them normally. They might joke with them once in a while, but they got their attention. They developed their relationship. They didn't have to do this. And one of the theories is that nuns could see the value and the worth of the person, as even as they were sick, they still held them with value and worth. That's just a philosophy. So I want to tell you about this. To me is one of the most exciting researches that come out, and you've probably heard about it, but it's called the stereotype embodiment theory set. And this is a study done by Becca Levy. I'll tell you a funny little story about Becca Levy, not funny, but the more you start to learn about these, the more you learn about it, and the more that you're online. I started going to small groups, and Ashton Applewhite, who wrote the book, This Chair Rocks, I was involved in some of her smaller groups. And one day I was in this group, when they put in little boxes online. And when first I just looked up there, I go, oh my God, that's Becca Levy, the author of this book, and I thought, oh, this is so cool, she's here. And they broke us up into small groups. And you guys, I was in the small group with Becca Levy, and I was going, my God, I gotta tell you, as much as I'm talking right now, I couldn't say a word. I just had fangirl, I was like, wow, I just wanted to hear from her. But if you can read her book, and we'll show you her book, and she's also got some great YouTube. I encourage you to do that. But in her study, she found out that the more somebody had a negative view of aging, of their own aging, of aging, if they had that view, they had a more increased risk of coronary heart disease, more increased risk of stroke, diabetes, chronic lung disease, chronic illness, but also more depressive symptoms. These people had more prevalence of suicidal ideation, anxiety, post-traumatic stress, and guess what? A higher level biomarker of Alzheimer's disease. So these were all things that were connected when she did the survey. This is her book. This is one of her books, this most recent one, Breaking the Age Code. And to me, this is very interesting because we know about internalized ageism, the negative views. And so she told us that, that people who had negative views, they were not going to engage in physical activity. If we want people to have a positive, to be more involved, they have to have hope. If they don't have hope, why are they going to exercise? Why are they going to, engage in preventive behaviors? Why are they going to go to regular exams if they have a negative view? To them, there's no point. This is just some of the, this was by a study done by PLUS. They did a large study from Yale. 422 studies were reviewed. In these studies, there were, I forget now the number is like several thousand people were involved in these. But you can see that, how it affected when they saw that people had a negative view of aging. These are just some other studies, and I'll go through that. But here is something very important for those of you in the field of working with older adults, and those of you, working with people who have dementia. In the study, she found that people who had APOE4 gene, that even if they had a positive view, a negative view of aging, that could buffer them in terms of developing dementia. People who had a positive view of aging, even with the negative, with the APOE4, that could protect them. This is very big news. When they were also doing the study, and they looked at neurofibrillary tangles and amyloid plaques, the more the negative view of stereotype that they had, look at the severity of the tangles and amyloid plaques. The more they had a negative view, stereotype of aging, the less the hippocampal volume they had. This is just another study. This is the Australian study I was talking about. And the conclusion, of course, is that ageism, can be an important factor in the health and well-being of older adults. And it needs to be taken into account when we look at strategies. Here's how ageism is affecting people and health professionals. The number of people who are trained in geriatrics is going down. And part of that is, physicians are getting out of Medicare. People who are having adults with multiple chronic illnesses are excluded from studies. People as they're older, they tend to have multiple chronic illnesses, and that means that people who are doing studies, it becomes problematic for them. There are things that they can do that can change that. Yes, it's extra work. Yes, it's extra, it's extra procedures, but it can be done. This is an older view, 2017, 2018. However, and what I looked at just recently, in terms of people who are going into pediatrics and geriatrics, it is a very big difference. The smallest group is geriatric medicine, even though it says that what I have, my recent studies show that 49.2 million Americans who are 65 and older, only 7,000 physicians have specific training related to attend the unique combination of ills that have to address the older population. Geriatrician, just let me clarify that for some people in case I don't know, is a physician who practices geriatrics. A lot of people say they are geriatricians. I'll call some doctor's offices just to say, do you have a geriatrician? They'll say, person answer phone, say yes, and they'll give me the name of a doctor. And that doctor's not a geriatrician. That doctor might be doing great work, might be doing a really good job working with older adults, but they're not a geriatrician. They're not trained this way. To become a board certified geriatrician, to become a physician has to successfully complete 3 years of residency training, either internal medicine or family practice, and a 1-year approved fellowship in geriatric medicine. In contrast, a geriatrician, it's not a gerontologist. A gerontologist is somebody who studies aging, and it doesn't necessarily have to be it's not like a doctor. You could, people with many different backgrounds could be gerontologists. These are some of the things affecting access in healthcare. Less people going into geriatric psychiatry, more aging population. Some of the things we talked about. I'll let you look at that. So you guys, this is the most recent numbers of board certified geriatricians by state. and Louisiana has 52. I've seen something else that shows 55, but for our population, when people says, well, people often say, well, you need to send your mother to a geriatrician. And I think to myself, that's so easily said. Find one. They're very difficult to find. There's 52 to 55 in the state of Louisiana. What that means is like there's one for like every 13,000 people. This is another great book I want to recommend to you, and it's Louise Aronson, and this is the book. And when she does her study about the healthcare profession and what's happening in medicine and what that means for the older adults, how they're being treated, this is a very scary statement. She says that the vast majority of older people are getting care from people who have little to no training in the care of older adults. This is the American Geriatric Society has every couple of years they come out with what this looks like in terms of our nation, about what the workforce supply and demand is. And here you see it. Look at 2030, which is coming right around. Look at the demand and look at the supply. We need a 50% increase. There's a 50% increase demand for geriatricians. That's a lot. And geriatrics workforce findings, I'll let you look at this. Social workers. And we all need more training. I say I'm constantly training. I've always got to be training. I'm looking at my time here, backward time. And you can see that, well, we all need more training and education on age-related conditions. We all need education on how to improve communication with adults with sensory impairments. We need more education due to shared decision-making. One of the things that we do that is ageist is that we automatically take away decision-making by older adults. And, we'll say, oh, this person has dementia, so we automatically take it away. When in reality, this range of dementia is very big. And there are people who have dementia that they can still deserve to make their own decisions. And this is something this is a real lack of education that we have. We don't give this enough attention. But I'll tell you what the training needs to be. The first training we need to do is we got to question our own lens. We have to question, where do I get my beliefs? Where does this come from in me? Before I'm starting to work with older adult, I need to know where my influences have been, what my background has been, what I've seen, and what I believe. And I'll tell you that in my culture, older adults, they are revered. Yes, there's much respect and dignity, but there's certainly ageism as well. I can tell you, I fully admit I am always working on this, because I myself am always working on trying to make decisions for my parents. And does it work? No. But is it my constant thing that I have to fight and say, okay, that is their decision to make? They are perfectly capable of making their own decisions. They're 92 and 91. And yes, they are still capable of making their own decisions. So for this education to start, everybody, we all have to know what aging is to us. And in a longer presentation, I do a 3-hour version of this. It's kind of like why I have to go through this so fast, because I'm not going to give you the 3-hour version, but I want you to have a lot of this. In the longer version, we have a strong discussion about what is aging. When I ask the audience, what is aging? Feel free to write it in the chat. But what is aging to you? And people will be honest, and they'll say, to me, aging means decline. And some people will say, well, to me, aging is freedom. To me, aging is growing. And to me, aging is living. I'm not dead yet. In the book, Breaking the Code, Becca Levy, she recommends this exercise, and it's called an age belief journaling. And she'll say, for 1 week, write down every image of aging you notice. I hope that when you leave today, when you leave this lunch and learn, But you'll start paying attention. You'll be out someplace and you go, oh, why did they make that remark? Why did they have to say old when they were saying old and something negative? Or why did they make that remark about, oh, well, older people? I really hope you pay attention, because the more you do, the more sensitive, but also more you're going to pay attention to yourself when you use it as well. And this is a good way to look at this age belief journaling. And this is available to you too. The implicit association test. This is a free Harvard test, and I took this test. And I studied this. I teach this. And guess who got a moderate automatic preference for young people over old people? I'm embarrassed, but there you go. There are some consequences that go with ageism, and that bleeds over. This is a whole nother talk. I'll tell you, when Brooke asks you about a talk to do next, ask about bias and negative stereotypes of people living with dementia, because I do a part 2 to this, and I really talk about stereotypes, why this bleeds into people, what this means for people living with dementia, and how that ageism bleeds over into this bias. But you guys, I'm not going to leave you with bad news. I'm going to tell you there is still some good news. There's a lot more public information. We're talking about it more. The baby boomers, we're not going to accept this. We're not putting up with this. We have more role models. We are paying attention more to an age-friendly health movement. I'm going to talk about that in just a second. We're making some changes in the clinical trials. Slowly, it's being included in diversity every time I have a chance. And I hope every time any of you have a chance, if you're at the table, ask that we also get ageism included in D&I training as well. It's a cultural training that needs to go. We have new campaigns and new models. We'll go through this. This is a change in the narrative. In Denver, Colorado, they adopted the Frameworks Institute. This is a really great training. If you ever have a chance, it's called the Frameworks Institute. And changing the narrative. City of Denver, they've gone really big with this, and they offer a lot of tools. And here's an example of something. I'll just give you an example. A provider, maybe a healthcare worker says, it's normal to feel depressed or some other health concern at your age. And the patient should respond, or can respond, is, I know many people my age and they aren't all experiencing this. Can you please help me find answers? And if you can't, maybe you can direct me to somebody that can. This is an example of a toolkits that are out now. The language that is about ageism bleeds over into language about implicit bias and negative views of dementia for stigma as well. This goes with the other talk. This was a study done in Australia about 100 women. It's by an older women's group. And when they went to a doctor, what the doctor told them, and they were full of anecdotes, but very clearly incidences of ageist to older women. The WHO, not the WHO, the band, but the Global Report on Ageism by the World Health Organization has a great toolkit. This is good news too. Now we know that there's the 4 M's and age-friendly health systems. If you're going to be working in an environment, or you're going to a healthcare environment, pay attention. Do they use the 4 M's? The 4 M's are most important because this is person-centered, right? This is about what matters, and that means what matters to the older person, not what matters to you, healthcare person, not what matters to you, social worker, but what matters to that person. Pay attention to medication use, because in a lot of age-friendly areas, they're looking at the use and the overuse of medication. Mentation, we want to prevent, identify, treat, and manage any kind of dementia, depression, and delirium across health settings. Mobility, we want to pay more attention to making sure that older adults are moving safely. When you talk to older adults, one of the things that affects them most, that bothers them the most, is their mobility. So these are the 4 M's. In addition to this, though, in the geriatric we have 5 M's. We have one, and what's included in this one is multi-complexity. And that's where we talk about older adults who have a variety of health conditions, and we have to pay attention to how that impacts them. They may not just have one situation they're dealing with. They might be dealing with several several health issues. In the book, this is another great tool that Becca Levy gives us as well. And she gives us the three things to do about strengthening our positive age beliefs. This, what she calls this the ABC method. And the first one is awareness. Identify where negative age beliefs are found in society. The second one is blame, and that is understanding that health and memory problems can be the result, or at least in part, of negative age beliefs. We know that now because we've seen the research. And then challenge ourselves, taking action. I want to tell you that the American Medical Society is taking on, they are assuming what WHO has put out as the definition of ageism. So they've taken what WHO, I keep saying the WHO like it's a band, sorry, but they are taking what WHO is, World Health Organization is taking, and they're adopting this. Guys, the good news too is now we know, right? This is, we know about the bad things, but we know some good things too. We know that people who have a positive age perception, they live 7.5 years longer than people who have a negative self-view. We know that older adults with positive view have better functional health. That means they can do more household chores, they can climb better. And if they have a negative perception, they're not as able to do this. We also know that in a study, a big study, 1,200 people, that participants who indicated that the aging is a time of continued learning, using their brain more, they had less physical illness 6 years later to people who had a negative view. They had more physical illness next years later. So we also know that intergenerational interventions for ageism works, that when we connect younger people and older people, the younger people are less likely to see the older people in a reduced way. They don't see them in a way that is, incompetent or in a way that takes away their dignity or worth. That's why we want to connect people. That's why we want to avoid isolating older adults. Those of you that are social workers here, this is our role. And you see that, in the blue, these are our values. These are our social work values, our ethics. If you're working with older adults, and let me tell you, if you're not working with older adults, you will be. But if you're working with older adults, our role especially is to develop our competence. Go to workshops, learn, read. We want to assess our clients for their own philosophy on aging. Ask them, talk to them about how they see their aging. We want to know that. We want to know, we want to be aware of ageist attacks that are affecting our clients. Those of you that have clients who you think, oh, I'm not working with older adults, I work with this, person, and she's 50 in the work world. I have clients who are 50 in the work world, and guess what? They're experiencing ageism, not in the way that you might think ageism is only for people who are 65 and older or people who have dementia. It is affecting people who are 45 and 50 in the work world. And I want to be aware of when they talk to me about how their environment is, I need to validate them. When they tell me that, I say, no, that's true. That is an ageist attack. And we want to assist them in self-advocating. But when we do this, we have to recognize, what is this person comfortable with, and what is it me, and what is them? Because I don't want to be putting my values on them about self-advocating. Because if they're not ready for it, I don't want to push them to it. But if they're ready for it, I want to help them with it. So educate, we want to advocate. And those of you that get a chance to, be at the table to make those decisions, those policies, those of you that are not social workers and you're citizens of the community and you are asked, I hope that you take the opportunity to pay attention to this as well. To when you participate, they ask the community. We want to know from the community who the key players are. We want them to be making participation in the policy and practice as well. Then we have to role model. We cannot be saying this and doing this if we ourselves are not doing that. The first time you say something like, I'm too old to learn this, I'm too old, I want you to pay attention to every time you say that, because people are listening and we want to call it out. Everybody will have their own way of calling it out. I call it out differently. I hope you still call it out, and it may not be the way I do it, but I hope that you do call it out. And who's our partners? Here's who we're going to bring in. Bring in all these people. Hospitals, family, retail, this is who we want. We're working together. So you guys, we've got about 9 minutes left. I'm just going to tell you a little bit about me, what I'm doing next. I'm still calling out ageism. I am participating in Bold Dementia Trainers. I want to tell you, LDH has a grant, and I'm one of the contractors who are doing dementia training. So I'll be doing that. I'll be very busy with that. I'm always busy doing educating and being educated. I spend my time in workshops, in reading and online, things that learning as much as I can. Also very busy with consciousness raising. The old school movement builders is something that Ashton Applewhite started, and it's a group of older adults, a lot of them from all over the world, and they talk about what they're doing in their own community. Some really neat people in those groups. I love that. Anti-ageist therapy. I work with older adults who I told you about, some of the clients. Family estrangement. It's interesting to me. Something family estrangement is very popular right now. It's a lot of people going no contact. And it's interesting to me that a lot of this is happening to older adults, that just as they are getting older, that maybe somebody who's seen a therapist who is not experienced, and that person is influenced to go no contact, when it might be a time when maybe the older adults could use the support and not be socially isolated from their loved ones. And of course, I'm a positive approach to care trainer. Anyway, this is the way you can reach me. I'm on LinkedIn. This is my email, GinaRossiLCSW@gmail.com. And let's pay attention. We've got about 7 minutes. Let me go back to the chat. I can't see it here. Maybe somebody.
Fantastic, Gina. Thank you so much for sharing all of that wisdom with us. That was fantastic. And I'm definitely looking forward to your future stigma presentation as well. So yeah, we have about 7 minutes if anybody wants to type a question into the chat. Gina, I will ask if you can go back a few slides to the book that you were referring to a few times, just in case anybody wanted to write that title down.
Okay, so there are a couple books. Oops. The one by Becca Lee, there's Tracy Genron, and that is Unmasking Ageism. This is a really great book, Breaking the Age Code, Becca Levy. And you can also, she's got some really good interviews online and on YouTube, Breaking the Age Code, Becca Levy. And then there is let's see, Tracy Gendron's book. And that is Unmasking Ageism. Oh, there's Elderhood, Louise Aronson. These are people who have done their research. Elderhood, Refining Aging, Transforming Medicine, Reimagining Life. I don't know why I can't go into the chat here. Maybe stop share.
And then I do see that one person, Jade, put the Harvard implicit association study that you had, or the test that you had shared your results from. She put a link to that in the chat box.
Thank you, Jade.
So I'll share that in our follow-up email as well.
Okay.
Okay.
Thank you. Any questions? Thank you, Michelle, for recognizing my veteran status.
One question that I have while we're waiting on some other folks to contribute is, I noticed you are doing another ageism presentation coming up. I think I saw you had shared something on your LinkedIn of a ageism day or seminar.
I'm doing several. I'm doing a build up for October 9th. I want people to pay attention to that. I am doing one in Bossier City for case managers. It's a tri-state group, Arkansas, Louisiana, and Texas, in Bossier City, and that's like an hour-and-a-half one. I am doing one for a local group with technology about ageism and older adults and technology. Honestly, I'm doing several. I'm getting confused which one that might be, but I do a 3-hour one. I do a 3-hour one mainly for social workers, and we do a deep dive about ageism, and we do it in various versions. Sometimes it can be about ethics, and I do a whole 3 hours on ethics for social workers. I do one on clinical. How are we going to work with people who, where their ageism comes from, and how are we going to work with them as therapists.
Mhm. Mhm. I'm curious, do you find, just through your experience, do you find that there is a part of healthcare that experiences more ageism than others, like hospital systems versus care facilities? I'm just curious if you had
I don't know one more than others, but I certainly in all of those. Okay, care facilities. I pay attention to that. Those of you that know me know that I expect to be a solo ager at some point. I will be alone, and the reason I became interested in working with older adults is that I expect that I will need to be in the healthcare system or in the long-term care system at some point because it's just my family history. But I pay attention to that. I pay attention to how, when I go visit somebody who's in long-term care, are there evidences of elder speak? And I know this is something that's very hard for us in Louisiana to give up. Okay, I know that in Louisiana we call everybody boo, sweetie, dearie. I know that that's part of our show of love and affection, but I want to remind people the research shows that that's not helpful to helping somebody maintain their dignity. And what it does is it takes away their feeling of being competent and being able to make their own decisions.
Mhm. Mhm. Absolutely. Absolutely. Okay. We've got about a couple more minutes if anybody else has a final question. Gina, what if you could tell anybody one thing about ageism, just like a final takeaway? What do you wish everybody knew about ageism?
I want you to know that it is the unrecognized discrimination. It happens to us every day, probably all day, and it is the one discrimination that we all are going to experience probably. And it also is even worse. It's doubled and tripled because it intersects with racism, genderism, and all of that compounds the effect on an older adult. It's one thing to have a discrimination because of your age, but when it's intersected with racism and genderism, if you're talking about somebody who is discriminated because of their race and because they're female, if you're, a Black, older female, then it's three things that that person is dealing with.
At the minimum, for sure. Well, thank you again so much. And thank you to our audience for showing up in a big number for us for this very important topic. This presentation will be recorded on and posted to our YouTube channel. I will post that link to our YouTube channel within the follow-up email. We have some past presentations from Gina on there, and then some other similar topics that we've done in the past. One that I'd bring attention to is living well with dementia, as we referenced stigma a few times. That is a recent presentation that we've done this year. Well, it's just at 1 o'clock. A lot of folks in the chat are saying thank you, great presentation, and a great chance to listen to this topic for you. So thanks, Gina, so much for your time and your talent and expertise. And thank everybody for joining us today.
Thank you all. Have a good day.
Thank you. Take care.